The on-site program is where, like I mentioned, I have a trainer. She's created from scratch all the classroom curriculum for these different specialty areas and present it to our candidates who do classroom instruction, depending on when we bring them in and how it's working out with the number of non-certs. They can do up to 3 days, several hours a day in the classroom while they're working the bench, going through the normal hiring and training and competency that you have with your typical techs. It allows us to provide that classroom instruction closer to the time they're actually working on the bench, which is greatly appreciated by the techs, but it's never perfect. It's hard to align classroom with on the bench training. The idea is that they're getting this classroom instruction to eventually learn it through the time they're in the lab with the initial training. Obviously, the con is really expensive, a trainer, and there's need, and we can only generally train in 1 or 2 specialties. It's not a generalist type program, which I can give you solutions for that as well, but maybe not in this presentation, but some other solutions if you want to speak about this further. So obviously, this program requires this individual coming in with a bachelor degree in the sciences, meeting the curriculum requirements. We expect them to become certified. So we give them a year on the job training, if you want to call it that, to then be eligible through ACP to become certified in a specialty that we have trained them in. A generalist takes up to 3 years, and that's certainly not something that we're able to do or we've been able to accomplish. There are some online programs that have been able to do that in a much shorter period of time, which I can share that information offline if you want to reach out to me. We put them through, like I said, the training and competency that we do with regular lab techs or medical lab scientist program. And they are working side by side with these folks. They may need initial more instruction in the beginning because they don't have the clinical lab background. But in fact, I was just told yesterday by my second shift lead tech that this NCT program has just been wonderful. These techs are working exceptionally well in the laboratory and performing beyond the expectations of the folks when we brought them in. And we have a whole lot of candidates. Another big benefit is when we put out a job ad for a non-certified tech, we get dozens of resumes as opposed to an MLS candidate. We may luckily get 1, 2 if it's an exceptional ad. So you can see that it's a big benefit with the number of candidates we work with. We hire the best of the best. We hire for the best candidate that we feel is the best fit for our laboratory. We do expect them to become certified. If they don't become certified, right now our cutoff is 30 months. If they're not certified within the 30 months, we will then offer them a role in the lab that they're eligible for. It has become somewhat of a concern with some of the folks, but they generally become certified, and it's a short-lived situation. A lot of it is we encourage them to become certified early on, and there's a fear factor with taking the exam and they put it off. So it's something that we promote is to take the exam early on and not put it off, because if you do fail the exam the first time, it can be difficult to get it fit in within the time period. The next, speaking on the medical lab assistant program, is an alternative to staffer lab. You can have an MLA versus an MLS. They can do, I believe they can do 95% of the work. Obviously, the things they can't do is resulting in high complexity work. They can do some of the moderate complexity testing and result entry in a lot of cases. So it is an alternative, a high school educated individual you bring in. We actually provide them 13-week classroom instruction to help facilitate them to transition in the lab, and also help them to become eligible to become certified as an MLA, which AMT and ACP provides that. There's very few accredited programs out there, so you're probably not going to hire them in from outside your lab. You probably have to be something you have to create yourself. Like I said, it's a high school education. The AMT requires 6 months, while ACP requires up to 2 years on the job experience in training. Like I said, we provide them additional clinical lab educational classroom instruction to help them prepare for certification. And once they become certified, we actually will promote them to an MLA too, as an incentive to become certified. And also the expectation is that they work in more than one functional area in the lab, that they're more well-rounded within the laboratory. They can work in pre-analytical, potentially in microchemistry, or even hematology, depending on the areas that they're trained in. So the idea is they'd work in the areas that the greatest need was at. In our anatomic pathology area, we've created multiple areas of training for folks to achieve histotech or HTL or histotechnist or technologist, excuse me. The LTA program is we have different varying levels of LTA. They're generally hired on as either associate degree or bachelor degree level folks. And we give them on-the-job training. There's 3 levels of LTA, LTA 1, 2, and 3, which the whole intent is to develop them to grow and develop and to continue on and gain certification as an HTA or HTL. And we also have a more formalized histology training program, where it's a 6-month program, which there again, just like in the clinical side, they're eligible to become certified through ACP after a year on the job, depending on what their educational requirements are, as I have listed here. So histotech, you need an associate degree or 60 semester credit hours, or a histotechnologist is that basically that bachelor degree individual that meets those lab, or I should say the science background that meets the requirements. Minimum 1 year experience on the job. Obviously, we train them and develop the competency and present to the ACP or that they are eligible for certification. So one thing, we put a lot of time and energy and training into these folks. We want to have a return on our investment. Obviously, that is we want them to become certified, so we retain them. We also want them to stay around even after certification. We don't have any penalties if they don't stick around. My philosophy behind that is I only want people to stay with us that really want to be here, and not because they're getting penalized because we have a penalty fee for leaving early, which I know a lot of labs have been doing that. And it has been pretty much successful for the most part. I'll show you some of the stats for that. But I really want folks that want to be here and want to work in the laboratory. And we created an environment that we believe that they will stick around, as we've shown. You can see the success stories that we have, the number of folks that we have become certified from non-certs to these different specialty areas. So the numbers are growing as time goes on, and we have a whole lot of folks in the pipeline. Here's the anatomic pathology program and where they're at with the numbers. They've not been doing this as long, but the numbers there again are growing. These are some of the pictures of the non-certified tech team members that have become certified. We do celebrate their certification. We do present this in our weekly newsletter and share their success story. So that's where these pictures come from. You can see the certification pass rates that you're seeing nationally for 23, 24 in the left column. You can show where our success been on the first attempt, and you can see we're almost 100% on additional attempts. So from a program perspective, we've been doing extremely well. And we recognize that everybody makes it on the first try. You see chemistry, for example, 39 to 40% only pass this examination. Hematology 60, 64%. So you can't expect to be perfect off the first go through. And a lot of it is just the fear factor and the preparation of the team members. We position them as best we can, but at the end of the day, they have to take the exam. We do give them practice exams to get them in a better place, and our retention has been very successful as well. You can see here we're hitting 100% for a lot of these folks, which is very a good feeling for me. We put a lot of time and effort and training into these folks, and we want them to stick around because they're loyal and have pride in the work that they're doing, and they want to continue working with WDL. So part of that, like I said, mentioned, we became ISO accredited to really promote our role in becoming a high quality laboratory. It's helped us create networks and engagements, and a word on the street is a lab to come. You can see here in 2024, we were the Lab of the Year runner up through the MLO magazine. So something that doesn't come easy.